After physiology or Kriya Shari, now we are going to study about anatomy or Rachna Shari. So welcome to our channel Pulse Ayurveda. So in this today we will learn about the bone clavicle. As you can see in the image, the red part marked is a clavicle bone. So in detail we'll study about it. So first introduction of it, clavicle. It is also known as collar or the beauty bone in females. It is a type of long bone which lies horizontally or horizontally placed. It is S-shaped in structure and it has a shaft and two ends. The two ends are divided into a lateral end and a median end. It supports the shoulder so that the arm can swing clearly away from the trunk. In this image we can see that it is S-shaped. It has two end, lateral end or acromial end, sternal or medial end. We can see its superior inferior view has been given. Then peculiarities of clavicle. So there are 6 peculiarities of clavicle. These are very important because these may be asked in spotting or in examination also. First, it is the only long bone that lies horizontally. Second, it is subcutaneous throughout. Third, it is the first bone to start ossifying. Fourth, it is the only bone which ossifies in its membrane. Fifth, it is the only bone which has 2 primary and 1 secondary center of ossification. And sixth, there is no medullary cavity. Then anatomical position. So the lateral end is flat and the medial end is large and is quadrangular. Okay. The shaft is slightly curved so that it is convex forward in its medial 2/3 and concave forward in its lateral 1/3. The inferior surface is grooved in the middle 1/3 part. Okay. So we can identify in this we have given the shaft, that the shaft is divided into 2 parts, that the lateral 1/3 and the medial 2/3. There is one mistake in this image, that there has been given lateral 1/3. It is not 2/3. Then the lateral 1/3 part in detail. This part of the shaft is flattened from the above downward. It has 2 borders, the anterior and the posterior, and it has 2 surfaces, superior and inferior. The superior surface is subcutaneous and the inferior surface has coronoid tubercle and a trapezoid ridge. We can see this all in image. There is the image given after this slide, after these 2 slides, so we can learn from there. The medial 2/3, it is rounded and has 4 surfaces, that is anterior, posterior, superior and inferior surface. It has no border as that of lateral 1/3. The anterior surface is convex forward and the posterior surface is smooth. The superior surface is rough and the inferior surface has an oval impression in its medial end. Okay, this point is very important regarding width of inferior surface, that inferior surface has an over impression in its medial end, and there is also nutrient foramen is also present there. So in this image we can see that at the inferior there is a trapezoid line, coronoid tubercle, subclavian groove. Okay, in this way ends, then lateral end and medial end, 2 ends are there. So the lateral or the acromial end is flattened from the above downward. It bears a fascicle that articulates with the acromion process of the scapula to form the acromioclavicular joint. We'll learn scapula after after this bone. You will then get to know there. Medial end. The medial or the sternal end is quadrangular and articulates with the clavicular notch of the sternum. With the clavicular notch of the manubrium sterni. Then the lateral muscle attachment, lateral 1/3 of the shaft. The anterior border gives origin to the deltoid. The posterior border provides insertion to the trapezium, that is trapezius, and the coronoid tubercle and trapezoid ridge gives attachment to the coronoid and the trapezoid part of the coracoclavicular ligament. All this will see in image. There has been given. These are the muscle attachment. These are very important. Then medial 2/3 part of the shaft. Its muscle attachment. First, most anterior surface give origin to the pectoralis major. Half of the rough surface gives origin to the clavicular head of the sternocleidomastoid. The oval impression on the inferior surface gives the attachment to the costoclavicular ligament. The subclavian groove lies in the incision to the subclavian muscle. The margin of the groove gives the attachment to the clavicopectoral fascia. Okay. Then the posterior surface close to the medial end gives origin to the sternohyoid muscle. In this image we could see that that red color has been marked to the origin and blue color to the now next we'll move toward the topic, that is this is very important, clinical anatomy. So the clinical anatomy of the bone clavicle is that the clavicle is commonly fractured by the falling on the outstretched hand. Then the most common site of the fracture is the junction between the two curvature of the bone, which is the weakest point. In short, we could say at the middle point of it. Okay, so in this image you have been shown. Then the third, cledocranial the clavicle may be congenitally absent or imperfectly develop in a disease or in a person. So here in there are two images given. So first one in which the clavicle is totally absent. This is the X-ray, and the second image. Thank you. And if you have any doubt, you let me know in the comment section.